but I just wanted to give you a quick update on what has happened. Our teachers and our paraprofessionals returned today to school. They are busy working on their classrooms. They're busy working on Canvas and other technology-related items. I was in the CHS this afternoon. It was very quiet. People were meeting. People were working in their rooms. The custodians were working. It was a nice sight to see people back in the building. We did have for everyone, when they returned today, a folder of personnel information. You got a copy of that. Just what we wanted people to know about returning to school. We've asked everyone to take a look at this and sign the document that's in green paper, just to make sure that people understand that there are different policies. The complete 20-some page safe and healthy health plan phase 2 and beyond is there for every employee to see it. We did add the face covering policy after last Monday night's meeting. It's on the back page. There is an entrance questionnaire to the office buildings that we're currently using for our staff. We are looking at an app for staff and students and families that can be used on their phone, but we don't have that quite ready. That will cut down on paperwork. We just wanted people to see what the recommended questions were for entering our buildings, our schools. This will be for staff, for students, and for any visitor to the schools. Then there is a Virginia Department of Education training document that we were advised to have all of our staff familiarize themselves with COVID-19 and what the signs and symptoms are, how you can find resources. It is small. We were trying to save paper. We have posted this on our website so people can take a look at it. We've also posted on the website a similar training for students and families, and we will continue to alert our students and families about this document, how they need to also look at it before they return their students to school. And then there is a document about returning to work, a guide for our employees, about things that we're doing to make their environments safe, what they can do to help us out. And then the document does talk about employees' rights. There are new rights for families, not for families, but for our staff members based upon COVID-19, and we wanted them to be aware of their rights. We have a COVID-19 travel policy that we have enacted and used over the summer for people that did travel. I understand the CDC may have somewhat modified that on Friday, and I'm looking to see what they've done, but we do have that travel policy in place to make sure our staff don't travel to areas they shouldn't. It will also be enforced for students. And then there is a personnel guidelines that does outline what rights employees have, again, what precautions they should take, and whether they think they qualify for one of the different acts that have been expanded because of COVID-19, which is a Family First Coronavirus Act. The Family Medical Leave Act has been expanded, and we're just making sure that our employees know about these rights. There's always the American with Disabilities Act that some people may qualify for. We just wanted everyone to be aware of their rights. We do have some employees that we will contact over this week and next week who indicated in the staff survey that they feel they might qualify for one of these different policy changes, and see if we can help them understand what they might need to do as they encounter some challenges in the workplace. I got a few more. We are working to get deliveries out to the schools of personal protective items, gloves, masks, thermometers, nursing supplies, and cleaning supplies that will be taken out to the buildings over the next few days. We're working on transportation plans to make sure that those students that do need transportation, we are giving them the transportation they need. We did ask families, because of the need to socially distance on a bus, to consider transporting their students. Right now, I think we have 60 students whose families have indicated that they need bus transportation. We will be making calls to see if that's correct or if there's more that haven't responded to our surveys. We have continued work this week and last week on the ventilation in our schools, the HVAC devices in the schools are being cleaned, filters are being added, devices to take the germs out of the air are being put into place. We have what we're calling Clinic C, which is a different clinic for individuals who might expose others to COVID-19 or they may exhibit symptoms. We're working to get that negatively pressurized this week in both Edgemont Jeter and also at CHS. Signage is being placed throughout the buildings to socially distance, to remember to wash their hands. We have more hand sanitizer stations that are being put up today as we speak, more coming to be put up in the various areas of the school where the principals want them. So we're continuing to try to make our environment as healthy and safe as we can. Today, Dr. Furman has submitted our instructional plan, or it's being submitted. It was required to be submitted 15 business days before we open schools. She and the principals have spent a lot of time getting that instructional plan together. There were certain areas we had to identify that we had met the requirements of the Department of Ed. We have done that. It's going to be posted on our website for families to review. That also included the hybrid instructional plan that we are going to implement on September the 9th, as well as a virtual learning plan. And I'd like to just give you a quick update on our virtual learners. As of Friday afternoon, we had 226 students who said that they were going to be virtual learners. That's about 22% of our population, and that is pretty close to what I've heard from other school divisions in Region 6, that 20% to 25% of their students have signed up to be virtual learners. We are going to deliver Chromebooks and hotspots on September the 8th. We have a Chromebook agreement that we will ask families to sign in the very near future. We'll be making contacts with families this week and next week about our Chromebooks and our virtual learning platform. Dr. Furman's here tonight if you would like her to provide an update on our virtual learning plans. I don't know if you have questions for her. I put her on the spot a little bit ago, but she can answer questions if you have them. I did also provide you, and I'll just keep moving, and then if you want her to speak, a Virginia map that shows, it's in color, all the school divisions throughout the state and what they're currently doing to provide new learning to their students. And if you see the color of the map, that fully remote is the dark green, and as of today, 67 divisions across the state are opening fully remote. We're over there under the two purples that we're all hybrid as of the moment. That will change once we submit our instructional plan. So this is being updated each day around 10 o'clock, and after we submit our plan, or it's finalized being submitted, we'll be probably changing to partial hybrid and some remote learning. The CDC continues to provide updates or modify their guidance, and as of Friday there was some more changes made, and I provided you that document. The flexibility, we must be flexible because things continue to change daily with the CDC, the Virginia Department of Health. And I'd like to give a huge thank you to our local Virginia Department of Health. Dr. Odell has been wonderful in providing our division updates and guidance. I send her an email on Sunday mornings, and by Sunday evening I have a response to her, and by Monday morning I have another response from her. Teresa Beyer is the local lead nurse here. She's been wonderful in providing the same kind of update that I might need. We monitor data all the time. They monitor data all the time for us. And I'm just so thankful for both those individuals who are working for us. We're also talking about flu clinics. There will be a big flu clinic on October the 7th at Dabney. It will be when they get their free vaccine. It'll be 3 through 7 there, and it is a drive-through flu clinic. We'll also have flu clinics here for our staff. That might be a little bit different than what we've done in the past, and we'll also do drive-in flu clinics for the public in our school parking lots. So those are just some updates that I have for reopening school. I'm just so proud of what we've done this summer, our staff has done. It continues to be amazing about what we've done to prepare to bring our students back into school on September the 9th. So do you have any questions for me or Dr. Furman?
I know it's a stressful enough time this part of the year preparing to open the school regardless of the current situation, but if you add that layer on there, I know with ever-changing guidelines daily and additional information and suggestions, that it is, multiplies that. So I appreciate all the hard work that you and all the staff is doing, preparing, and I know given the current social and medical landscape that we face, it is difficult. There will be disagreements and things of that nature, but as long as we move on, I think, and stay positive, we ask people to support us and support you guys. And we're trying to, we know that you're making the best decisions given the information that's been made available to us. So I very much appreciate it.
And as we stated last week, number one continues to be safe and healthy for all staff and students. So that does drive what decisions we make, and flexibility is key because we don't know tomorrow what we might hear. We don't know what we might hear on September the 9th. We don't have that crystal ball to tell us what might be coming our way, but I do think a lot of positive things have happened in our school division today and during the summer, and I believe they'll happen as we move into the school year, official school term, when our students are back in our buildings. So, any questions or thoughts?
We talked about it a little bit at the reopening meeting, but the flexibility to change that plan as necessary, we still feel good about where we're at flexibility wise, whether that be going to all virtual or some other phase not yet discovered.
Well, I do think we need to still be open to the possibility that we might need to change our delivery method in a heartbeat, a moment's notice. I think we're ready to go either way with what we currently have in place, or if we have to go all virtual because of number of cases rising, I think we can be ready for that. We still have time, which is good. Time is on our side, September the 9th, and I think that time will help us make the right decisions as we come closer. I think next week's meeting will be another good time to look at, are we still in a good place to bring our students back in. I think bringing our students back in is important. I think they need, those that want it do need that direct instruction in our buildings. It would be so good to see them, but we also have to make sure we weigh the other side and make sure we're doing the safety and health things that we need to do. So there's still time, and I don't want to make that switch today. I don't think we're ready. We meet every Tuesday with Dr. Odell through a superintendent's phone call. So I think each Tuesday we get more information, and she tells us whether we're going in the right direction, or if she recommends that you move in another direction. That's when Roanoke City did make the move to go all virtual because the numbers were continuing to rise in Roanoke City. I think Roanoke County opened today, which is in our health district. Botetourt County opened today, which is in our health district. So we can watch what's happening in those two areas to see if they have any changes when they bring their students in. Floyd County opened almost 10 days ago. Bristol opened last Thursday. So there's a lot of school divisions that we can watch and see if they're getting good data from all the safety measures they've put in place, and we can see if we are making the right decision for Covington City Schools.